Representative Steinberg, you can go ahead.
Thank you, Madam Administrator. Good morning. I'm State Representative Jonathan Steinberg, co-chair of the Public Health Committee. The committee is convening a meeting to consider a referred bill, substitute Bill 6510, which we'll get to in a moment. But before we start, I will ask if there are any remarks from the chairs and rankings. Good morning, Senator Abrams.
Good morning, everyone. Welcome.
That was very good, abrupt greetings. Representative Pettit, good morning.
Thank you, sir, Mr. Chair. Greetings from the People's House here on Capitol Avenue. I'm looking forward to hear from our committee members with dual membership on children's and public health to explain this bill to us. Thank you, sir.
Thank you for your remote directly from the chamber of the House. Senator Wong, good morning.
Yes, indeed. Good morning. Excited to get started. Looking forward to hearing this issue.
Excellent. I don't know. I see Senator Summers in the room, if you will. If you're there, Senator Summers, good morning. 3, 2, 1. All right. I'm sure she'll join us shortly. And we will be keeping the votes open after we conclude with today's conversations. The one item on our agenda today, as I mentioned, is House Bill 6510, a bill referred to us from Children's. And rather than attempt to describe it myself, I hope to yield to our committee member and chair of the Children's Committee, Representative Linehan. Good morning.
Good morning. Thank you very much, Chairman Steinberg. I appreciate you throwing it to me. I know brevity is our friend here, as we have senators who've been awake all night and fellow House members who are looking to start our day as we get into session. So I'll be as quick but thorough as possible. This bill actually started in Children's and is coming to you because essentially we are requiring the provision of information concerning children's mental health services in hospital emergency rooms. Here is the quick reason on how it came about and then exactly what it does. Essentially, in my district, I've spoken to a lot of families who, over the course of the pandemic, haven't really known where to turn for mental health services for their children. As we've mentioned many times in this committee and in my committee, the Children's Committee, currently there are only 86 board certified child and adolescent psychiatrists in the state of Connecticut. There is an extreme drought here and across the country. And so when parents are concerned about their child's mental well-being, they call a psychiatrist and they get on a wait list that is sometimes 6 months or more. And what we're seeing now is that parents are then bringing their children to the emergency room. The Connecticut Children's Medical Center has seen an uptick of almost 10 percentage points of children who screen positive for risk of suicide in their emergency rooms just in the past year since the pandemic started. It should be noted that Connecticut Children's does screen all children in their emergency room for risk of suicide. Even if you're there for a broken leg, they screen and the numbers keep going up. So in addition to that, Rep. Nolan from New London, who is a police officer, came to me and said that he is bringing more and more children to the emergency room as he comes to their homes for calls regarding mental health issues or behavioral issues, and that he's seen that there's been an intense lack of wraparound services, or at least knowledge of those services, after those children go to the emergency room. So there's multiple calls. They're bringing these kids to the same emergency over and over again. So that all of that information together spurred the idea for this bill, where we will be requiring that the Department of Children and Families creates information on a regional level about where parents can go to get their children this help. While there is a lack of psychiatrists, there actually is not a lack of services available on the psychologist level or the therapist level. And that is a necessary first step if you can't get in to see a psychiatrist. So what would happen essentially is if any child is brought to any emergency room in the state of Connecticut for a behavioral health reason, suicidal ideation, or any risk of or even has any risk of suicide, positive screening for any other reason that they're brought into the emergency room, that this information is provided to the parents upon discharge about where they can go to access mental health help for their children. And it should be noted that I'm already working with the Department of Children and Families on this. And as soon as this legislation passes into law, that information will be available to go already to the emergency room. So this is something that is desperately needed. It is ready to go. And everybody is on board. It did pass out of committee unanimously, but Mr. Chair, just really briefly, there will be an amendment on the floor. That amendment actually doesn't change anything about the bill. It just clarifies that DCF is creating the document in consultation with the other departments, and that they're taking the lead on that. So with that, if there's any questions, with your permission, Mr. Chair, I'm happy to take those questions and provide some answers.
Thank you, Representative, for that really cogent explanation. Clearly, this addresses a couple of issues that we've talked about a lot in this committee, access to mental health services, particularly for younger people, and also the importance of making connections upon discharge so that people end up in the right hands and get the right follow-up care. And it sounds really important. We have a couple of questions for you, starting with Representative Betts, followed by Representative Arnone. I assume the questions are coming your way. We'll see.
Okay, thank you very much, Mr. Chairman, and thank you for that summary. And we're all on the same page about trying to address this need. But the question that comes to my mind is recently on what is today, Tuesday, we had a debate about this explanation of benefits, and that minors, whoever they might be 15 years old, 16 years old, may seek mental health treatment, but the parents are not necessarily notified of that. And I thought I heard you say here that they would be notified if their child is there. So I wonder if you could explain what would happen in reality if the bill we debated on Tuesday became law. How would that impact what you're trying to do here?
Sorry. I'm sorry, Mr. Chair, I didn't hear. Did you throw that to me?
I just said that through me, which is a new phrase.
Yeah.
To you.
Yep.
Thank you, Mr. Chairman, and through you, Mr. Chair. If the explanation of benefits law actually is signed into law, it really doesn't change any of this at all. What happens is that the child is in the emergency room. If they are by themselves and they're discharged, I am not sure what current law allows if a child can go to the emergency room. I'm not sure what current law says regarding emergency medicine, if they need to have a parent with them to be treated. But this provision of information will be given to anyone upon discharge, both parents and children. It's really written for the parents. However, I would like to state, when we're talking about children being treated for mental health, current law, it's already in law that says that children can have a certain number of mental health sessions with a mental health professional, and a parent doesn't need to be notified, with the exception that if a child is a danger to themselves or others, then the mental health professional is required under law to notify someone, and that is most typically the parents. It really doesn't change any of that. It's really just the provision of information so that they know where to go to find those providers. Whether or not those providers are operating under current law, where they don't need to have consent for their child to be treated, or they're operating under what could possibly be the new law, which would just have an explanation of benefits about that treatment. This bill has absolutely nothing to do with any of those. Through you.
Thank you, Representative. Does that answer your question sufficiently, Representative Betts?
Yes, thank you very much, Mr. Chairman. Thanks for the answer.
Next up is Representative Arnone, followed by Senator Huang.
Thank you, Mr. Chair. Through you, Mr. Chair. So I ran this through our local social services youth director, and we sat down and discussed it. There was a couple questions that came up, and that's if a hospital doesn't participate. And on referrals, you had said that there would be a pamphlet available, and we're doing that on a local level too. But will there be referrals to EMPS or to, you know, the mental health crisis intervention services? Will they set that up for them right away, or will that'll be up to the parent?
Representative Lenahan.
Thank you. And through you, Mr. Chair, that is a really great question, Representative. It will include information on the Crisis Service Center and calling 211 and getting mobile crisis out. 100% it will. It does not include private referrals. What it does is it includes information on those that are partners with the behavioral health services within the Department of Children and Families and DEMIS, and hospitals must participate. So it's wonderful that you do it locally. This will be an extension of that. And what we can do is actually include information possibly about local social services. The only concern with that is that we're talking about, let's just use Waterbury, for instance. I live in Cheshire, and I might go to St. Mary's in Waterbury. So I can't be referred to the Waterbury social services. I would need Cheshire social services. So someone could potentially, I could go to Lawrence Memorial, take my kid there because that's where the issue happened, and we wouldn't be available for that area. But what will happen is the information given out will include where to go for other areas. So because we're doing it on a I don't remember what they're called. There's zones. DCF uses the term, I believe, treatment zones or something similar to that. But in addition, there will be a link to go find out for other areas and other zones. So it will be pretty comprehensive. And then we'll also have ways that parents can look for more information on the web.
No, that's perfect. I thank you and the committee for bringing this bill forward. That answers questions locally, and I think that's exactly what we need to do on a state level instead of on a local level, and depend on local services to provide this. It needs to be provided on a state level, and it looks like this is exactly what it's going to do. So thank you, Mr. Chair.
Thank you, Representative Arnone. I will ignore the fact that you didn't have the floor of that last statement. We're just going to go right past that. Senator Wong, followed by Representative Zubkis.
Thank you. Good morning. Good morning, Representative Linehan. Thank you for your good work on the Kids Committee. Take us through, and do you know why this bill was referred to Public Health?
To Representative Linehan.
Thank you, Mr. Chairman, and through you to the good senator. It was referred to Public Health because it mentions the Department of Public Health and it's in hospital emergency rooms. I will say that I don't think that it was 100% necessary, but I'm confident that sharing more information is always better. So sending it through this committee and just seeing the nods of the people as we speak about this bill. We all know that this is extremely important, and the more people that know about it, the better. So I look forward to the vote so we can actually get this to the floor. Thank you, and through you, Mr. Chair.
Thank you. And I will note that I've seen a very interesting trend of referral of bills this year that was a little different than in the past. Senator Wong, is your question answered?
No, I have some additional ones, Mr. Chair, and feels like we're in House proceedings with this exchange. But in reading through the testimony, there were only 3 provided, particularly from the Hospital Association and from an emergency medicine physician, as well as a provider of mental health services organization. All 3 of them applaud this effort, but nevertheless, all 3 of them had said it was not a necessary mandate. What do you say to those kind of written testimony from providers that obviously applaud the effort, but is saying that this perhaps may be a mandate that's not necessary? Through you.
Representative Linehan.
Thank you, and through you, Mr. Chair, to the good senator. What would I say? I would say that that is a cop-out. I would say that unfortunately, we have thousands of kids who are in desperate need of help. And we have parents who can't find that help for them. And I would say that as a parent who's had to be there, not knowing where I can get my kids the help that they need, as a woman of means, as a suburban white woman, as a woman who is politically connected, I couldn't find help for my kid. So what I would say to them is that if you think it's not needed, you're not paying enough attention to what's going on, and you're not listening to parents, and you're not listening to kids. This information is so incredibly needed. Parents need help. Parents need to know where to go. And when they're scared and upset, and they don't know how to help their child when they're breaking down in front of them, and they take their child to the emergency room, and the emergency room says, I gave them a shot of Haldol, and you know what? That's the most we can do for them because there's no beds available. Thank you and have a good night. I would say to those that think that this is an unnecessary mandate, to talk to those parents who are walking out of that emergency room terrified of what's going to happen to their child when they get back home that day. And without that provision of information, without a little bit of hope to explain to them where to go and what to do, it's a shame that we're not doing that. This is not going to cost the hospitals any money. Everybody that is inside this bill is all for it. And we are ready and able to go at a moment's notice, which tells me that it is extremely important. So I'm going to have to say respectfully that I believe that the hospital association and hospitals, that they believe this information is not necessary, they are sorely mistaken. Through you, Mr. Chair.
Thank you. And I am so sorry that you had to go through such an experience as a parent. I would never want to have that happen to any parent or any child. So my thoughts to you on that. That being said, were there any other testimony from just as impassioned and as relevant that were available that we didn't see in the testimony? I would venture to guess that you're not alone, without a doubt. But I was just surprised I didn't see any other testimony. Perhaps there may be other ways I can find out where people's experiences and incidences of non-reporting are validated through you, Mr. Chair. I don't even know if I have to go through, Mr. Chair, in a public committee meeting. But nevertheless, let's follow that process.
Senator Linehan.
Thank you. And through you, and the process is fun. So let's just keep doing it. Yeah, you know, there was testimony actually during the committee meeting that was not submitted written testimony. So we've had plenty of people talk about the bill. I am not sure what was put in the JF report, so I don't know if you were just looking at the JF report, but the Department of Children and Families testified that this is needed. Connecticut Children's testified that they support it. We've had the Suicide Advisory Board support this. We've had DEMIS support this. So, and just recently, the Behavioral Health Oversight Board has been working with me, and they're thrilled to be on board. So there's a lot of support for this. I apologize if the JF report didn't include that, or if it was just the fact that it was spoken testimony and not written testimony. But I can also assure you that we are in the middle of a pandemic with an epidemic inside the pandemic. And so I would be wary of saying that we would have an influx of adults of parents who are saying that they've been going through this, because mental health and getting your child to a safe place is not something that can be done by just, you know, heading to the emergency room and putting a cast on something or taking some medication. It's an ongoing process of treatment that is exhausting. It is all consuming. And I would be absolutely shocked if a parent can drag themselves away from making sure that their child is safe in order to hop on a Zoom meeting to testify on this. I just know that parents like me and police officers like Representative Nolan, who are in the midst of this every day, know that this is desperately needed. I hope that
Well,
answers your question, Senator, through you.
It does, and it's incredibly helpful because as I'm looking at the records, there were only three testimony on file, and I will be eager to look at the files and get some feedback. So, and I'm very eager to see if indeed testimony was submitted and not posted. I would dearly like to read it, but I appreciate the feedback, and most important of all, I appreciated the opportunity. Has the committee a cognizance in the issue of public health, medical health, and medical services and mental health to be able to have an opportunity to learn more about this bill, even if it's from the Kids Committee, having the opportunity to refer it to the Public Health Committee for dialogue and engagement. So I'm grateful that we followed the process, and I'm appreciative that I had an opportunity to get this information and make me more informed. So thank you, Mr. Chair, and thank you for your time and effort and your presentation, ma'am. Thank you, Mr. Chair.
Representative Tupkis, followed by Representative Pettit.
Who did you call on?
Representative Tupkis, you.
Oh, thank you, Mr. Chair. And I'm sure this probably will go through you to Representative Linehan. So if I may. Thank you. Representative Linehan, I believe you answered this question already, and my apologies for asking it again, but I want to be very clear. So I am confident that the explanation benefit law will go into effect. It will pass. If it does, will children with this piece of legislation that you're speaking of, will children that are a danger to themselves or anyone else will the parents still be made aware? Through you, Mr. Chair.
Thank you, and through you, absolutely. It is imperative that when a child is a danger to themselves or others, that a responsible adult is notified. And remember that they are mandated reporters. The mandated reporter law still applies. The explanation of benefits bill has nothing to do with this legislation, but just very quickly, that's just talking about sending it after the fact for some sort of treatment. But ultimately, if that treatment includes that someone is a danger to themselves or others, it is still law that they must report that. So yes, 100%, Representative. Through you, Mr. Chair.
Representative Tupkis.
Thank you very much.
Excellent. Representative Pettit.
Thank you, Mr. Chairman. Just a comment, it may be obvious to everyone on this committee. I think the underlying issue really is that we need in this state via the medical societies, via whatever we can do from the state point of view, is try to increase the supply of mental health providers. I think the limiting issue in terms of whatever we try to do is access to appropriate referrals, be it social workers, psychologists, psychiatrists, et cetera. So that's a big issue that we're going to have to continue to tackle in this committee. Thank you, sir.
Thank you for that comment. Representative Converse-DeGraw.
Yes, thank you so much, Mr. Chair. Also a comment on the similar vein. I have personally experienced this also as a parent, but I would also say beyond that, the level that I've experienced from hearing from my constituents, especially of having to spend 24 to 48 hours inside of that emergency room at CCMC, and that's not disparaging CCMC at all. They do a wonderful job. The doctors and nurses there are excellent. But unfortunately, this is an ongoing issue. I will tell you that, personally, we started with our pediatrician because, again, I'm a white suburban woman. I'm a woman of means. At the time, I was not politically connected, so that didn't affect it. But even when you go to your pediatrician, they give you a list. And, often the first 3 are not taking new patients. So it's really critical that when you are at the level that you need to go to an emergency room, that you have access to more than one resource, because often the first, second, sometimes even third resource that you get to may not be able to take you, not because they don't want to, but because they're just not able to. And a 10% increase may not seem like a lot, but it is incredibly significant. And I also think that is not indicative of the numbers that we're probably not catching, or that may be in the next 6 months, the next 12 months. So I thank the good chair for answering the questions today of the Children's Committee, and I'm just so grateful that this bill is hopefully going to move forward today. Thank you.
Thank you, Representative. Representative Betts for the second time. Representative Betts, maybe your hand is.
I should have lowered my hand. I don't have any more comments or questions. Thank you.
Thank you. Are there any other questions or comments before we have a vote? If not, Madam Administrator, please call the roll.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Madam Representative Pettit votes yes, and in communication with Rep. McCarty to try to get her reconnected to the meeting, Madam. Thank you.
Representative Pettit, is she using a cell phone?
She has been on a cell phone, Madam.
Okay, thank you. Representative Arnone,
Representative Arnone votes yes.
Representative Berger-Givallo,
Representative Berger-Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino, Representative Cook, Representative Dauphiné, Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Rep. Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes yes.
Senator Kasser, Representative Cabras-DeGraw,
Representative Cabras-DeGraw votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Clarides Detrier,
Representative Clarides Detrier votes yes.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarty, Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon, Representative Terziak, Representative Young,
Representative Young votes yes.
If Representative Terziak can sneak in, I'd vote yes.
Representative Terziak,
Thank you very much. I'm sorry. Representative Terziak votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong,
Senator Tony Huang votes yes.
Senator Summers, Representative Carpino, Representative Cook, Representative Dauphiné, Senator Casser, Representative McCarthy, Senator Moore, Representative Ryan, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we'll be holding the votes open until 10:30 this morning. Representative Pettit, do you have a comment?
Representative McCarty has been unable to get sound to work. She's en route to Hartford, so hopefully she'll get here before 10:30 and be able to vote when she's here. Thank you, Mr. Chairman.
Thank you, Representative. We'll be rooting for her to get here safely and in a timely way. If there's no other business, this committee is in recess. Thank you all. Have a great day.
You too. Thank you. Thank you.
Thank you.
Thank you.
Beverly, did we vote?
Representative Ryan, how would you like to vote?
At least for 1 minute, the meeting's over. I said we're going to be here for 20 more minutes. Yes, I would like to vote, ma'am.
Thank you, sir.
I'll vote in the positive, in the affirmative.
Thank you, Representative Ryan.
Okay, it's good to see you, Miss Henry.
Have
Have
a
a
good
nice
day,
day.
sir.
Hello.
Good morning,
Hello.
Senator Summers.
Good morning. How are you?
I'm doing okay. How would you like to vote on the House Bill 6510?
I would like to vote yes, please.
Thank you very much.
Thank you.
Have a good day.
You too. Take care. Bye.
Bye.
Beverly. Beverly,
Good morning, Senator Moore. How are you?
I'm sorry, I dozed off while I was listening.
How would you like to vote on House Bill 6510?
Senator Moore votes yes.
Thank you very much. Have a good day.
Thank you, dear.
Good morning. Beverly, can you hear me?
Good morning, Rep. McCarty. How are you?
Oh, good morning. I'm so glad. I had the worst experience. I heard most of the meeting, and then all of a sudden I was disconnected, and I'm trying to get back. So I'll vote fast. I am a yes.
Okay, well, okay, now I can speak. Rep. McCarty votes yes. Thank you, ma'am.
Yes.
And
Thank you. I don't know what happened. I was on the meeting and all of a sudden disconnected, and I let Bill know, and I couldn't get back in without sound, so I tried it again. So thank you very much.
oh,
Sorry,
thank you.
I
No,
did-
gosh, no apologies. Thank you. And I hope the rest of you have I can't speak now. The rest of your drive is safe. A lot of people, it's been challenging for a lot of folks this morning. Thank you, ma'am.
Yes, but
Bye-bye.
at least I heard most of the meeting. Bye-bye now. Thank you.
Thanks. Good morning, Rep Cook.
Good morning. I'm sorry I lost you guys earlier, but then I had to drive, so.
Yeah, no, it's been like that for a lot of folks this morning.
Yes, so, go ahead.
How do you vote on House Bill 6510?
Rep Cook votes yes.
Thank you so much. Appreciate it.
Thank you very much. You have a wonderful day.
You do, thanks. You should look at the view from the sunroof. It's beautiful.
Oh, that is a cool view.
It's really good.
At least you know I'm parked.
Right. Bye.
Bye, honey.
What's your deal anyway? Well, you can find out on this week's episode. You are not a nudist. Style is for you. I've been in the fashion and styling business for 20 years. Most people know me from Queer Eye. I've probably helped literally thousands. Your company's heart valves are endangering human beings, and you know it.
Hello.
Hi, Senator Kessler. How are you?
Hi, fine, thanks. How are you?
Good, good. How would you like to vote on House Bill 6510?
Yes.
Yes.
Senator Castor votes yes.
Thank you so much. Thank you. Thank you. Hope you have
Thank you.
a good day.
Thanks, you too.
Bye.
Bye.